Okay, good afternoon.
Afternoon.
My name is Millicent. I'm the nurse who will be doing your head to examination, and I thank you for giving me this time to do it. Okay, the general condition of the patient the patient is not pale, there's no jaundice in the eyes, and he looks healthy, so the patient is okay. So from there, I'll have done the vital signs. We did the vital signs. Temperature is 36.2. The blood pressure 120/60. Heart rate of 82. Respiration of 20 rels per minute. Oxygen saturation 96. The weight was 65 and the height 68 centimeters. The BMI 25.6. From there, I'll ask to check the mental status of the patient. Habari, unaitwa nani?
Naitwa Kennedy.
Kennedy nani?
Lumanda.
Oh, Kennedy, huku ni wapi tuko?
Hapa tuko kwa hospitali.
Hospitali.
Yeah.
Oh, umetoka wapi?
Nimetoka Kawangware.
Kawangware. Okay, na uko na miaka ngapi?
Niko na miaka 50.
Oh, president wa Kenya ni nani?
Ni Uhuru Kenyatta.
Okay, na saa hii ni kama saa ngapi? Tarehe na saa?
Saa hizi tarehe 27. Saa 10.
Okay, so the patient is well oriented to person, time and also place. From there, I'll start with the head, whereby I will do the inspection of the head. There is no lump, there is no edema, there is no lesion that can be seen. The symmetry of the head is okay. Hair distribution is also okay. There is no any rise or any infestation that can be seen, and there is no alopecia, so the patient is okay. I'll also go on palpate the head for any lesion, for any mass, for any tenderness. Unasikia uchungu pahali popote? So all the areas, the frontal, the parietal, the occipital, there is no mass, there is no lesion, there is no tenderness of the head. So from there, I'll check the ears. The ears, I first start by inspection of the ear for any lesion, for any mass, for any growth, and there isn't any. From there, I do palpation of the same ear, and there is no anything, there is no nodule, there is no mass that can be felt. So we inspect with palpate, there is no mass, there is no nodules. From there, we check inside the ear. Kindly allow me. So there is no excessive curamen. The eardrum look okay. It is not inflamed. It is well rounded and also translucent. There is nothing abnormal that has been seen. So we check the other ear. We check the other ear by lifting the lobule. So there is no excessive curamen. Eardrum look okay, it's shiny. There is no inflammation of the ear. There is no anything abnormal that has been seen. From the inspection of the ear, so we go to the eyes. So I inspect the eyes. So there is no any lesions. The sclera looks white, it's not yellowish. There is no redness. There is no infection on the conjunctiva. So the eye looks okay. From there, I go to the nose. There's good air entry on the right ear. Good air entry on the left nose. So I also check the septum. It is middle located. There's no abnormality. The symmetry is okay. The nose is well located on the middle of the face. So there's no discharge. I check inside the ear. There's no polyps. There's no mass. There's no lesion that can be seen there. And the ear looks okay. So we go to the mouth. So the lips On inspection, the lips are pink with no any lesion or mouth ulcers or the ulcers that can be seen. So I check inside the mouth. Kidogo niangalie ndani ya mdomo. The tongue is pink with no beef colorness that is seen in pernicious anemia. It is pink and also moist. I look at the side of the lip of the cheek. There is no sores that can be seen. Well moist, pink in color. That shows the blood is okay. I check on the other side, so also it's well. The color pink is there. There is no mass. There is no any tenderness or there is no sores. We look under the tongue. Under the tongue, there is no mass. There is no lesions. There is no ulcers that can be seen. All the teeth look okay. The teeth are okay, and even up there, the palate, the soft and the hard palate is okay. The uvula is located on the middle. Kindly say So the uvula at this point, I am checking at the glossopharyngeal. The uvula is able to move up and down when the patient says So from there, I go to the neck. The neck I inspect for any lesions, for any growth. I assess the trachea. It's not deviated, it's centrally located. There's no mass on the trachea. On inspection, nothing abnormal is seen. I palpate the neck also, and there is nothing abnormal that is seen. From there, I look at patient goes at 45 angle. Look at the jugular vein. There is no jugular vein distension. I check the other side, 45 angle. The jugular vein is not distended. From there, I check the carotid. Unilaterally, I palpate for it. It is okay. It's not. There is no distension. It's pulsating well. So I also listen for any breaths on the carotid. It's right there on the groove near the trachea. So there's no breaths. It's pulsating well, regular. It's a +2 regular and pulsating +2. The rhythm is regular. The strength is okay, a +2, and it's also regular. There are no breaths that can be heard both sides of the carotid artery. From there, I do the palpation of the lymph node, the periauricular, postauricular, the palate. Unasikia uchungu?
Iko sawa.
Checking for any tenderness, for any enlarged nodules, the parotids, then the occipital, the jugular, then the mandibular, the submental, the superficial clavicle, the deep cervical chains, the occipital, cervical, the posterior cervical, and the clavicular. All the nodes, all the lymph node, there is no tenderness, there is no enlargement, there are no nodules or mass that can be had on palpation. From there, I'll check the 12 cranial nerve. One of them, I'll start with the olfactory nerve number 1. Tafadhali nataka ufunge macho, uniambie unasikia ni nini hii nanuka. Ni nini hiyo?
Ni coffee.
Yeah, this is coffee that I have pressed here. So the cranial nerve number 1 is intact. Pumua. So the olfactory nerve is also okay. So we go to the cranial nerve 2, the optic nerve, whereby I'll check the vision, accommodation, and also the peripheral view. ninataka uangalie hapa kwa hii kalamu, then nitaleta kwa kama naleta mbele, usimove uso wako but macho pekee. Direct. Wow, the eyes are able to accommodate well. So we also look at the peripheral side. Tena nitamuvisha hii kalamu, usimuvishe kichwa, ni macho pekee. So nikienda chini unaenda chini, nikienda juu unaenda vile macho linaenda. So chini can be able to see downwards, upwards. The eyes can be able to move upwards. The eyes can be able to move on my right side. The eyes can be able to move on my right side. So the peripheral view is okay. The other thing I want to check is for the patient is able to read. Unaweza soma hapa?
Yes.
Nisome hata namba zenye unaona.
Temperature 36.2. BP 120 over 60. Weight 65. HR 82. Height 68.
Okay, the patient is able to read even at a distant object. The other thing I'll check for is the reaction of pupils to right. I'll introduce the right on the sides. So the pupil is able to constrict. Bilaterally, the pupil is also able to constrict. So on conclusion, I can say the pupils are round, reactive to right, and they are accommodating well. So we have finished the cranial nerve number 2. So we want to also check cranial nerve 3, 4, 6. That is oculomotor, trachea, and abducent together. That allows the movement of the eye. Fanya hivi, move your elbows hivi, hivyo. So he can be able to move his eyes like that, up and down. Nafanya hivi, eyebrows. Yeah, hivyo can be able to move the eyebrows up and down. Then ningekuuliza pia uangalia pia hapa, like hata kidole hii yangu pia nikimuvisha hivi move. Alafu unaweza niambia ni vidole gapi?
Vidole mbili. Mbili. Vidole mbili. Vidole mbili.
Sasa funga jicho moja. I'll also close mine on the same side. Funga hii. So fungua hii. Unaona ngapi?
Moja.
Funga na mkono.
Na moja. One.
Fungua hiyo ingine na mimi nifunge hii ingine.
One.
Yeah, the movement of the eyes, he can be able to move the eyes up and down. Umeona like you are seeing double vision?
No.
Hakuna double vision. Okay, so the patient can be able to move the eyes up and down with no double vision, and there is no abnormal movement of the eyes. So I can say the cranial nerve 3, 4, and 6, the oculomotor, trachea, and abducent, they are all well. So I also go ahead and check the cranial number 5, that is trigeminal. The ability of the patient to realize the right touch, and the soft, and the hard, and the pinpointing touch. Nataka ufunge macho. Niko na vitu mbili hivi, utaniambia ni gani inakuguza, ni soft ama ni pointed one. Okay, so ukisikia nikuguza uniambie ninaguzwa. Ukisikia nikikuguza uniambie umesikia ama hujasikia.
Okay. Nimesikia. 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 Nimesikia.
That is, the patient is able to feel the right touch.
Nasikia.
Mhm.
Nasikia. 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 Nasikia sharp. Nasikia.
Okay. The patient is able to feel the sharp and also to feel the soft. Niambie na kushika na sharp ama soft. Funga macho.
Nasikia imenishika na soft. Nashika na sharp. Soft. Sharp. Sharp. Sharp.
Yeah, I can be able even to differentiate between the sharp object and a soft object touch. From there, we can say that the trigeminal nerve, number 5, is also intact. From there, we look at the mastication. Nataka ufungue mdomo. And then nataka nijaribu kukufunga nione kama unaweza resist. So, he can be able to resist, when opening the eyes, he can be able to resist the force of closing it. From there, clench the teeth na nguvu. Clench. Ni kushikanisha meno na nguvu. Meshikanisha. So, I can feel the masseter muscles, they are very tense. Also the temporal muscle. That is the nerve that controls the chewing of the food. The crunching is also intact. So we also check the facial nerve that controls even the closing of the eyes and the symmetry and the eyebrow and the smile and the frowning, the facial expression. Sasa nataka ufunge macho, nijaribu kuvifungua nione kama. So he can close his eyes without being opened, and then sasa fungua, smile. Well, so he can be able to show facial expression. Kasirika. Okay. Plop up your ears like this. Yeah. And then even when I try to overcome the force, it can be able to resist it. So the facial nerve is also intact. The other nerve number 8 is vestibulocochlear. I want the nerve that controls your hearing. So nataka nifunge hii masikio, alafu niseme kitu utaniambia venye nimesema. Nimesema?
Hello.
Yes. Nifunge hii ingine. Hello. Nimesema?
Hello.
Yes, the vestibulocochlear nerve, that is cranial nerve number 8, is also intact. So we check at the glossopharyngeal. So, hebu jaribu kumeza mate. The patient is able to swallow and was able to say and the uvula was moving up and down. So glossopharyngeal nerve is also intact. The other nerve I'm checking is the accessory nerve. Shrugging of the shoulders. Yeah, can be able to shrug the shoulders vizuri. Yeah, and they are equal, and he's doing it equally bilaterally. And the last one, the hypoglossal, the one that controls the movement of the tongue. Move up and down, ulimi, side by side. Yes, he can be able to move his tongue up and down. So the glossopharyngeal is also intact. So from there, we go to the upper extremities. I start with inspecting the upper extremities. They are equal in size. There is no pallor. There is no jaundice of the nails. The capillary refill is 2 to 3 centimeters. The nails are also pink in color with no crabbing that can be seen. So from there, we palpate for the arteries. I start with the radius. The radius artery is pulsating with good rhythm. It's regular. It is strong at +2, and there is no. It is also strong that can be heard. Also to come to the brachio bilaterally, comparing the two. it has a good strength, pulsating a +2. It's also regular. There's no abnormality that can be had. So from there, I check the range of motions. I start with the fingers. Yeah, na thumb. Yeah, the patient can be able to move the fingers well. So the range of motion of the fingers are okay. So at the elbow, the range of motion on this hand is also okay. You can be able also, the range of motion of water. Okay, we do the range of motion at the elbow, moving well. So moving well, we check for strength, nisukume na nguvu. Yeah, I can be able to push me, na mimi nikusukume ukianguka ni shauri yako. Yeah, I can be able to resist a push. That means the arms has enough strength. It's a +5. Nifinye mikono na nguvu. Nifinye hizi vidole zangu na nguvu. So also you can be able to press. So it's a +2. So we have checked the position, the range of motion, and also the strength. From there we go to the chest. Unaweza toa kabisa. Toa kabisa because ya mgongo. I'll go to the back at one time. So in the chest, I start with the inspection for any lesions. Hapa kuna pimples. So there is some pimples hapa, but there is no mass, there is no lesions, there is no any scar that can be seen. That is in inspection. From there, I palpate for any mass, for any growth, and there is nothing that can be hard. The bones are okay. From there, I do the auscultation, whereby I'll start with the auscultating the cardiovascular system, checking at the aortic, the pulmonic, the EPS, the mitral, and the tricapsid and the mitral. So I start with the aortic. Pulsating at a good strength, it is also regular. Here, the dub sound, that is S2, is heard the roundest. The second intercostal space on the left, that is the pulmonic. Pulsating well, regular, good strength. Here, the S2 is the largest. I go down the third intercostal space, the EPS press. There is good pulsation, good rhythm, regular, and also a +2. There is no here. There is no valve. So I go to the tricapsid, which is the fourth intercostal space. Here, the S1 is hard round. It is regular, and it is a +2. That is mean it is strong. I come to the mitral, that is a mid-clavicular, the sixth intercostal space. The S1 here is hard louder. At the tricapsid and the mitral, the S1s have been hard louder, and they are regular, and it's a +2 also. So I've checked all the nini. So I check for the mamas. Now I'll turn to the bell on my ultras of the stethoscope. I turn using the bell, checking all the areas that have gone. In the right second intercostal space, the second intercostal, the right side, aortic, there is no mama. Pulsating well without mama. The EPS press, there is no mama, pulsating well. Tricapsid, pulsating well with no mamas. Mitral, no mamas, pulsating well. And then after that, I listen to the heart, to the lungs, using the diaphragm of my stethoscope, starting with at the apex. Pumua na nguvu. Good air entry, no wheeze, no long cry, no stridor. From there, I go to the second intercostal space, looking for the upper lobe of the lungs. Good air entry with no rhonchi, no wheeze, no stridor. I check the other side. So good air entry with no abnormal sound like stridor, no rhonchi, no crackles. From there, I go to the fourth intercostal space. No rhonchi, good air entry. There's good air entry, no rhonchi, no stridor, no wheeze on the nini. So from there, I check on the sixth intercostal space at the lower lobes. So there is good air entry, there is no rhonchi, there is no stridor, there is no wheeze, there is good air entry. Pumua na nguvu with good air entry, no rhonchi, no stridor, no wheeze, no abnormal pleural or friction that can be had. So on inspection of the chest, or on the examination of the chest, the lungs, there is no rhonchi, there is no width, there is no stridor. The air entry on all the areas is also okay. So we check the abdomen. I'll kindly request you to lie down. On the abdomen, I'll start with the inspection of the abdomen, checking for shape. It's well rounded with no obvious growth or mass, no any lesion. There's no any scar that can be seen on the abdomen. The next thing I'll do is I'll auscultating of the abdomen, starting from the right lower lobe, going anti-clockwise until I reach the other end. So the boil sound are there, 3 to 30 per minute. There's Tiffany, I can hear some Tiffany. And then here, there's dullness because of the presence of the pancreas. So I can hear the dull sound, but the boil sound are also present, and they are adequate. So here, where the liver is, there's dullness also. The boil sound are present, and they are within the normal range. Here down, Tiffany, boil sound present. It's not dull. Good or enough boil sounds. So from there, so I've done inspection, I've done auscultation. From there, I do the palpation. I'll start with the right palpation and then I do deep palpation, checking for tenderness. Ukisikia uchungu niambie. Checking for tenderness, for any mass, for any distension. So this is right palpation, about 2 centimeters. There's no mass, there's no tenderness. Unasikia uchungu? There's no tenderness. No mass, no tenderness, no distension. I do now the deep palpation where I go 4 to 5 centimeters, checking for mass. There is no mass. There is no tenderness. So I also check the liver, measure the liver, which is about, it's around this. So you can feel the liver, which is about the liver. I can feel the liver, which is about 4 to 5 centimeters from here to here, and you see there is no tenderness. There is no tenderness, the liver is okay. So from there, the same place, I rotate the pancreas, which is around this place, with no tenderness. There is no any organomegaly. There is no hepatomegaly. There is no splenomegaly. So the liver and the spleens are also okay. From there, I want to auscultate for the aorta, for the renal artery, for the iliac, and also for the femoral. So the aorta is just above the umbilicus, checking for any bruits. There's no bruits. Pulsating a +2, it's also regular. No bruits, a plus pulsating with a good strength, it's also regular. That's renal. The other renal artery is pulsating well, no bruits, regular, it's a +2. The iliac, pulsating, a +2, also regular. No bruits, pulsating, it's with a good strength, +2, it's also regular. The femoral, just located here, regular, pulsating well, regular and pulsating well. So all the arteries in the abdomen are okay. So from there, I do the percussion starting at the lower side. Tiffany, dullness. Dullness, the areas that are dull is because of the presence of the liver and also the spleen. The Tiffany, because of the air-filled, the intestine are filled with air. So the genital urinary, kuna shida na kukojoa? Una shida? Kuna uchafu inatoka njia ya mkojo? Hakuna. Unakojoa vizuri, hauna shida yoyote? Okay, ni sawa sawa. So we have percussed. So and I'll forget about the percussion of the chest. I'll percuss at this time. Resonance. Yeah, the chest is percussion is okay. There is no hypo or hyper resonance. The chest is not having any fluids. So percussion of the chest are also done. From there, I'll check the reflexes or the lower extremities. I'll check the lower extremities. So the lower extremities, they are all equal. They are equal in size. There is no mass. There is no edema that can be seen. There is no joint redness. The joints look okay with no inflammation. Okay, on inspection, there is no also any fungal infection that can be seen. So the legs are okay. So from there, I'll start with the, after inspection, I palpate the artery, the popliteal artery that is just behind the knees. I am doing them bilaterally. I can feel they are all equal, pulsating well, and with good rhythm, and they are also very strong. It's a +2. Coming down to the tibia, checking for edema, for the pitting edema. So he doesn't have any pitting edema, and you can see the color is also good with no hyper or hypopigmentation. I check for the capillary refill here. There is no abnormality. I now come and listen to the arteries, the radial pedal, the arteries, they are bilaterally. They are strong, pulsating well, and they are also regular. So there is no pedal edema, so they are okay. From there, I'll check the reflexes. I'll kindly request you to sit down. I'll check the reflexes. Come on this side. I'll check the reflexes. So the reflexes, I'll start with the brachioradius, the brachioradialis. The brachioradialis, you can see it is bringing the supination and also the contraction of the muscle. Yeah. So from there, I check the tricep. No, this is bicep. The bicep. So there is contraction of the muscle and of this muscle and the other muscle. Relaxation mkono. I check the tricep. Relaxation takushikilia. So you can also see the movement of the muscles and the contraction of the muscles that is as it occurs. I check the other hand. Relax. Mkono yako ikuwe relax. Yani kama umehang. So you can see how it is the movement of the toes and the supination that has occurred. The bicep also. So the muscle here contract and also this contraction, the tricep. Weka hivi urelaxisha mkono. Yani mimi nikushikilie ni kama imehang. The muscles here can contract, all of them are contracting. So from there, I check the patella jack. Nataka uihangishe mguu yako kama imehang hivyo. Usishikilie. Yani, So you can see there is also movement that is good. So there is also good. There are chilies. So there is, it's good. The other one is Babinski. You can see the fingers are moving they are moving downward when I move them. Yeah, you can see the fingers are moving like downwards when I pass. So that is intact. So in summary, the reflexes, there is no hyper reflex. I can say they are all +5, and there is no excessive movement of the reflexes, or the low or hypo or hyper movement of the reflexes. I'll request you we check your back. So I start with the inspection of the back for the continuity of the spinal cord. It's good, moving well. There is no masses, there is no lesions, there is no enlarged or anything that can be seen that is enlarged. From there, I do the palpation. So there is no also growth, there is no tenderness, there is no pain. I reach here at the costovertebral angle, whereby I check for the inflammation of the kidneys or any infection in the kidneys. So also here at the costovertebral angle, both the right and the left kidneys are also in good status. From there, I do the auscultation also of mostly the lungs. So I'll start with the apex. Pumua. Tena. There is no stridor, there is good air entry, no wheeze, no long kai. From there I go to T3. No stridor, no long kai, no wheeze that can be heard. Good air entry, no stridor, no long kai, no wheeze. Bilaterally the air is entering well. Tena kumona nguvu baba. Good air entry, there is no long kai, no stridor. Good air entry, no long kai, no stridor. Good air entry with no long kai or stridor. Good air entry, no long kai or stridor. Hauna shida yote ya mgongo, si ndio?
Sina shida ya mgongo.
Okay, ni kama tumemaliza kufanya examination na nimeshukuru sana. God bless you.